Our bodies communicate with us even while we sleep. Nighttime discomforts might seem minor, but they can signal underlying issues like diabetes. These signs are often missed during the day, but become clear at night. Don't ignore these whispers. They could be important warnings. One of the most common nighttime signs of diabetes is frequent urination, a condition known as polyuria. When blood sugar levels are high, as they often are in diabetes, the body tries to flush out the excess glucose through urine. This leads to increased urine production, making you wake up multiple times during the night to use the restroom. This disruption can significantly impact your sleep quality, leaving you feeling tired and drained during the day. If you find yourself making frequent trips to the bathroom at night, especially if it's a new development or accompanied by other symptoms, it's essential to consult your doctor. Another related symptom is excessive thirst. When the body loses fluids through increased urination, it triggers a natural thirst mechanism to replenish the lost water. This can lead to increased thirst, especially at night, making you reach for that glass of water more often than usual. This excessive thirst is the body's way of trying to dilute the high blood sugar levels and maintain electrolyte balance. Remember, while staying hydrated is important, excessive thirst that disrupts your sleep could be a sign of something more serious. Restless nights, restless body. More than just a sleepless night, restless leg syndrome, or RLS, is a neurological disorder that causes an uncontrollable urge to move your legs, often accompanied by uncomfortable sensations like tingling, creeping, or pulling. This is caused by a deficiency in vitamin B1, which is depleted due to high blood sugar levels. A lack of vitamin B1 causes lactic acid to accumulate in the muscles, preventing oxygen from reaching them, leading to pain. For some, the symptoms of RLS are worse at night, interfering with sleep and leading to daytime fatigue. If you experience uncomfortable sensations in your legs that disrupt your sleep, don't hesitate to discuss them with your doctor. Nerve problems and cramps at night. Diabetes can cause nerve damage, leading to nighttime symptoms. High blood sugar harms nerves, especially in the feet, causing burning, tingling, numbness, or pain. These feelings can make it hard to sleep. Leg cramps or painful muscle contractions can happen suddenly. They are often due to dehydration and electrolyte imbalances, common in diabetes. If you have ongoing numbness, tingling, or pain in your feet, talk to your doctor. Diabetes can mess with your sleep, causing night sweats and sleep apnea. Night sweats happen when blood sugar levels change a lot. Low blood sugar or hypoglycemia can make your body release adrenaline, causing sweating. Sleep apnea means you stop breathing for short times while sleeping. Diabetes increases the risk of sleep apnea and can make it worse. These issues can ruin your sleep and health. It's important to deal with them quickly. Another symptom is vivid or bad dreams, which are linked to a neurotransmitter problem caused by a deficiency in vitamin B1. High blood sugar depletes B1 levels. You may also experience sudden spikes in blood pressure at night, a condition known as non-dipping. Normally, blood pressure should decrease while sleeping, but due to diabetes, it remains high, disturbing your sleep. Lastly, teeth grinding during sleep is another symptom linked to fight or flight mode activation, which is caused by stress, tightening the jaw muscles. Recognize and address nighttime symptoms. They can be early warning signs. Pay attention to these signs and seek medical advice. Your body is constantly communicating with you. Listen to what it's trying to tell you, even in the stillness of the night.